And
Yeah.
so then another one of I guess techniques
Yes.
is having the patient slowly, slower is the slower better, kind of like open up the jaw, like
Mm-hmm.
slowly opening and closing the jaw as you're getting um, into the working out those trigger points and stripping
Yeah.
the muscle through there, and then something, and then that, and then also you can have them clench as well and do things with that.
Mm-hmm.
So there are quite a few things
Well, of course.
that you can do. But yeah, I mean, generally, it's it's yeah, I'm trying to create um, the most relaxed environment as possible to allow that joint to relax as much as it can.
Yep.
So,
And the more you can get space off of a joint
mhm.
and the more blood flow you can get to
Yes,
the
yes, blood
muscles,
flow, like, yeah,
yeah,
hmm,
the more
yeah,
you're going to just speed up that
hmm,
healing
yeah,
process and remove more of
hmm,
the barriers to
hmm,
healing so the body can heal itself the way that it's supposed to.
hmm,
Sounds crunchy granola to say
hmm,
that we are amazing, powerful
hmm,
organisms capable of healing ourselves, but
hmm,
it's because it's true.
hmm,
And our jobs as providers is to take those barriers away, right?
hmm,
And you had lots of amazing techniques on that. I would say how we fix it, it comes with that exercise first approach. And
hmm,
so if we find that directional preference at the jaw, then
hmm,
that's what the patient is going to go home and work on.
hmm,
That's also going to help to kind of guide me on how I should probably overpressure the jaw for the patient while we're working on the muscles as well too.
hmm,
You mentioned the open the jaw and have the contacts to strip through the masseters and the
hmm,
temporalis trigger points.
hmm,
Love that technique. I don't think there's a
hmm,
single TMJ case I take where I don't do that.
hmm,
Now, here's where I go a little 50-50 flip a coin. So,
hmm,
depending on how irritated the TMJ is, we
hmm,
definitely want to do some sort of cervical adjustment, whether that's traditional chiropractic, the snapping and cracking of the joint,
hmm,
or if we feel like doing something that's more like a mobilization to encourage a little more neck traction with retraction in there is a better idea. We kind of play it by what the patient could tolerate
hmm,
or previous medical history or their
hmm,
expectations. Like there's a lot that goes into a decision of do
hmm,
we adjust the neck. The
hmm,
same is true with the jaw, though. There are actually jaw
hmm,
adjustments, and they would look really similar to setting up a neck adjustment, except for instead of making the contact on the articular pillar of the neck, the contact goes kind of
hmm,
square on the jaw, and then we
hmm,
can actually kind of do that rotary move with the neck and push the jaw along to really kind of reset that TMJ joint.
hmm,
This is one of those, it just depends on
hmm,
the patient. Some people we figure out like, hey, we need to hit that TMJ
hmm,
joint. We need to open that up some more and get
hmm,
that adjustment done. And other people, it's like, hey, you know what? We've been doing really well with more of the muscle work, overpressure, and stretching tactics. You're getting better that way. Let's
hmm,
not go and do something that's too aggressive and runs the risk of setting you back. I would say
hmm,
generally how I work with it is I start
hmm,
without the adjustments and see how
hmm,
progress is coming along.
hmm,
Kind of a less is more type of
hmm,
idea.
yeah,
Because you mentioned how you got to be careful with not overdoing
hmm,
it to just make it
yeah,
hurt for the sake of hurting.
yeah,
But then if we're plateauing out or just not seeing the progress, then as long as there's not red flags, we say, okay, maybe now it's time
hmm,
to actually put the adjustment force on the joint
hmm,
of the TMJ and see if that
yeah,
makes a difference.
yeah, and like a lot of what you're alluding to is the communication between the patient and the provider, which is so crucial, because that can
It
almost,
is.
it's like just as important than the techniques that are being done,
Yeah.
because you need to have the feedback from the patient to know what's working and what they're comfortable with, and what may be the best solution
Yeah.
for them.